are there any different symptoms of COVID-19 when having Fabry disease? As I had many symptoms and my chest swelled up by 3 inches whilst having difficulties to breathe when I was really ill a number of weeks ago. Could this have been COVID-19? Who would want to respond to this?
Well, probably both of us. I may start. So my global comment is COVID-19 is very dangerous. You know, all the population is at risk. You know, that's the take-home message. Again, I don't think that Fabry patients are more specifically at risk. I mentioned this risk of combination of 2 hits on the same organ. When it comes to respiratory symptoms, I'm not absolutely convinced, since our personal experience here were relatively mild disease for our Fabry patients. And of course, for this person asking the question, the recommendation would be to get tested. He or she should now try to get, you know, the serodiagnostic test to be on the safe side and know if he or she has contracted the disease some weeks ago, yes or no.
Yeah, I fully agree. So the disease has many different symptoms, and difficulty breathing is one of them. So the only way to know would be to test for antibodies.
What about the next one? Could a burning sensation on the tongue, in the throat and chest be symptoms of COVID-19 if you have Fabry disease?
I don't know personally. The opposite, this anosmia and ageusia is very, how can I say, very well mentioned by patients. You know, they will tell you, oh, doctor, during a couple of meals during 1 week, I was eating something and I could not, you know, feel any taste, you know. So this is very, very nicely explained. The opposite sensation, so a burning in the tongue, was never reported to me.
Yes,
Okay.
I'm not aware of burning sensation in the tongue. In the throat and chest may be related to the throat and chest infection.
Okay. And I think we already received a response to regarding the hydroxychloroquine in both of your presentations, that apparently Dr. Trump might be the only one who believes in it at the moment.
Anna, if I may, so I have to admit, I was initially supportive because 20 years ago, I worked at the Pasteur Institute, and we would use hydroxychloroquine to actually disturb the lysosomal function. So basically, for not only Fabry patients, but I would say all lysosomal storage disease patients, this is very likely not a good thing. And I remember at the time I was infecting macrophages by a pathogen, so very similar to this story. So it was just leishmania, it was not a virus. And when we would add the hydroxychloroquine, we would get giant lysosome, because those drugs, they are weak base, so they will alkalinize the pH of the lysosome, which for normal functioning has normally to be acidic. Okay, so it's probably not a good thing at all. But of course, in the case of COVID-19, initially some cells may integrate the virus, cut it in small pieces, you know, and present those pieces in the immune system, you know, to then help the defense of the organism, of the body. But again, when we learn about these cytokine storms, this inflammatory response, I think it was not completely stupid to consider how temporarily disturbing the normal functioning of the lysosome could have possibly prevented, you know, this how can I say, excessive presentation of this part of the virus, and inflammatory response. It was a pure hypothesis, but I think that subsequent works did not confirm this at all. And I would like to finish on this point, drawing the attention of the community on also the potential risk of amiodarone, because it has not, of course, been mentioned in the setting of this COVID-19 epidemic, but the principle is more or less the same. So amiodarone, which is an excellent antiarrhythmic drug, you know, that cardiologists usually like very much and has proven very useful in mitigating, you know, some rhythm disturbance symptoms expressed by Fabry patient. It's also a kind of poison of the lysosome. And there is a very nice short article by the Canadian group has been recently published, questioning ourselves, you know, on how we should act in the presence of rhythm disturbance symptoms, you know, in Fabry patient. Should we use that drug? Yes or no? And after almost 20 years of research, I have to admit that the answer to this question is not clear in my mind, and I think warrants further research in the next year for the benefits of Fabry patients. Sorry for this long comment.
Okay, thank you. I can see the chat box is filling with thank yous and congratulations for excellent presentations. And I think the hold on. Is there still you are not both in the same place regarding okay, the last question is that we can take is Fabry disease a high risk chronic disease for COVID-19 or not? From the audience.
I think we should, the experiences is still very few. So Dominique has 4 patients and they did pretty well, but it's only 4 patients and relatively young. So I would err on the side of cautiousness. So it's a disease that may have endothelial problems, may have cardiac problems, may have thrombosis problems, may have kidney problems. I would consider it high risk until it is demonstrated that it is not. But it's very nice to see the nice experience by Dominique regarding the severity.
Yes, yes. With this, I would say that the lack of more questions is a compliment to your presentations, which were excellent. Before I hand over to Lutz, in the end, I would like to emphasize that since there's a lot of information going around, we would like to remind you of the reliable sources and the importance of reliable sources for information on COVID-19, which you can see on the slide here. And without further ado, I give the floor back to Lutz.
Okay, thank you, Anna. And thank you all for your questions and for taking the time to participate in this webinar. Beck, thank you for your expert panel, for their valuable contribution, and also thanks for our industry partners for their ongoing support. We will continue to gather information and share this with you in our community. Like we also said in previous meeting, we plan to schedule in more webinars in the near future. And do not hesitate to reach out to us during this difficult time. We don't know what the near future will be, but we hope to see you all back in our next meeting, and stay safe. Thank you all.